Today we're getting ready to talk about binge eating disorder and how it affects the VCU students. We're going to talk about shame, different symptoms of binge eating disorder, interventions, community resources, and offer a safe place for individuals to ask questions. Hi guys, welcome. My name is Adina Silvestri and I am a licensed therapist in private practice in Richmond, Virginia. I specialize in treating women with substance abuse issues, and another subspecialty and a real passion of mine is treating individuals with binge eating disorder. So today I just want to have a conversation about binge eating and talk about the shame that is associated with binge eating, and hopefully we'll get the discussion started, and it won't stop here. So what does it mean to be only as sick as our secrets? What does that mean to you? We are only as sick as our secrets. Yeah.
That if you keep the secret that you're sick, then you're just gonna stay sick. If you're not getting any help, then you're not gonna get any better.
Right, right. So the idea is to talk about this disorder, to tell people that you care about, because you don't know what they're struggling with. They may have similar issues with food or with drugs or with alcohol, and so it really just promotes hope. I'm going to tell you a story about Miranda. Miranda is an individual that came to me about a year ago, and she really helped me to understand the disorder a lot better. Miranda was a 20-something college student, and she was at the top of her game. You know, straight A student. She was also a competitive bodybuilder. So from the outward appearance, you would think, well, you know, Miranda, there's nothing wrong with her. I mean, she looked great, but she was suffering in silence. And so she presented to me with anxiety, just about, you know, college life in general, depression. But it wasn't until she started talking about the way she felt when she looked in the mirror, the self-loathing. And then she said something that really triggered me. She said, you know, I had a cheat meal today. I said, what does that mean? Who here knows what a cheat meal is? Yeah, okay. And I said, okay, so this isn't just anxiety, depression, right? This is something more. So Miranda really introduced me to binge eating, and she let me know that if you don't ask the questions, you're not going to get any answers. So, you know, it's not, you know, binge eating it's all around us. You know, it's with athletes, men and women. So just to kind of give you a different perspective of what, you know, the face of binge eating looks like. And I'll be talking about Miranda as I go through my little presentation here. So social media definitely plays a big part in how we view ourselves. Who here is familiar with the three Sports Illustrated covers for 2015? Yeah, what was different about those covers? Yeah, plus size model. Who else was on the cover? Somebody that was not the typical Sports Illustrated model, right? Was it mixed martial arts? Right? Right. Ronda Rousey. So that was different. Sports Illustrated really took a chance. And if anyone gets an opportunity to see Ashley Graham, the plus size model's TED Talk, it is very inspirational. I highly recommend it. You know, she really talks about just always being told from a very young age that she was the pretty fat model, you know, and just always qualifying her looks. She would say, "I'm a model," and they would just kind of look at her cross-eyed. Really? So now she has the last laugh, which is great. Okay, so you have a handout, the top 10 questions to ask yourself. If you don't have a handout, I'm sure we can get you some later on. So I'm just going to spend a little time talking about this. These are some questions that you may want to ask yourself. You may want to give it to a friend, gently. But number one is eating much more rapidly than usual, right? In a discrete period of time. So maybe in about 2 hours. Eating until uncomfortably full, and then you feel guilty afterwards. So you're past the full threshold, right? You're eating large amounts of food when not physically hungry. So, you're not just eating a few pieces of pizza, you're eating the whole box. You're not just eating 1 or 2 cookies, you're eating the entire, Chips Ahoy box. Eating alone because you're feeling embarrassed about how much you're eating. So with Miranda, the woman that I talked about earlier, she would just wait until all of her roommates were gone, and she would hole up on the floor of her kitchen in front of the fridge, and she would just eat. It's shameful, It's something that you feel bad about. Shame and guilt, as you know, are very different feelings, and you don't have to do something bad in order to feel shameful. It's very secretive. No one has to know about it. Feeling disgusted or ashamed with yourself, feeling depressed that you've eaten as much as you have. So number 6, progressive weight gain with periods of weight loss. So with the bodybuilders that I was telling you about earlier, this was very common. They would eat 50% of the allowed amount that they were able to eat, and then they would have cheat meals, and then the up and down cycle would just continue. They would feel guilty because they had a cheat meal, then they would binge some more. It was just a really horrible cycle. Avoidance of feelings, number 7. If you're with a therapist and your therapist isn't talking about how you're avoiding your feelings because you're binge eating, that's a problem. Avoidance of feelings and interpersonal relationships, those are the 2 main issues that individuals that suffer with binge eating disorder have. So, if you don't have to have a bad relationship with food necessarily in order to have binge eating disorder, but if you're upset, if you're bored, if you're depressed, what is food going to do for you? What's it going to do for you? It's going to what? It's going to... Yes, release endorphins, dopamine, the neurotransmitter dopamine, for sure. Right. Okay. So food feels more important to me than to my friends, something that I hear often with my ladies. And again, that sort of goes back to the quote that I talked about earlier, we are only as sick as our secrets. If nobody knows that you need help, if nobody knows that you're struggling, it feels very isolating. So you want to reach out to people. Because there is power in being vulnerable. There really is. It's not a weakness. Number 9, owning shame-based identity and insecurity. Again, this is another one that if you're working with a treatment team, you want to hit. You want to talk about the shame that you feel. You want to talk about what it feels like to look in the mirror, to not be happy with what you see, to not love your cellulite or your thighs that are, jiggling. You want to talk about that. Number 10, again, with the having difficulty with relationships. If anyone knew about this, they would hate me, they would reject me, they would leave me. So So let's talk a little bit about resources and treatment. You really want to, when you're looking for treatment, you want to have a PCP that specializes in binge eating disorder. And you also want to have a dietitian that specializes in that as well, and a therapist. And all of those individuals need to be working together. But that's the least severe treatment. The more severe, if you're binging, if you severe weight loss or weight gain and you really need some help, there's hospitalization, there's inpatient care, 24-hour care, acute residential, partial, and intensive outpatient, so that's maybe 3 to 4 times a week. So there are options out there. So I just want to touch one more time on really finding help and finding the appropriate help. Because if the people that you're going to aren't talking to you about your motivation, how motivated are you to get better? How motivated are you to not binge, to not restrict? What is this? How functional is this disorder? What is it doing for you? Or do you have a close relationship with your dad because you guys can share cheat meals together? Do you get more attention because mom knows that you're sick and so she's more, giving? So you want to make sure that you talk about the functional aspects of the disorder. And the treatment team needs to be talking to you about the tools that you have. So basically, when you feel an intense emotion, you need to feel it, even though it's difficult. So with Miranda, we did a lot of expressive art, and I would have her paint. And I remember in one specific instance, she threw a bunch of paint on a canvas, and she said, and I gave her like a time limit, 15 minutes. I want you to, paint a sailboat. I like sailing. So I want you to paint a sailboat. And she said, we got to the 15 minutes, and she said, I have to keep going. There are still paint on my canvas. I need to finish this. And I said, no, Miranda, the time is up. And she said, I'm shaking. I have to finish this. And so really just telling her, Miranda, we just need to sit with this feeling of anxiety, and I need you just to feel it with me just for a few minutes. Really trying to get her to regulate her emotion. It's another hallmark of treatment that you should be exploring with your treatment team. So just to end and pass it on over, I want everyone to go home today and just really challenge yourself. Look in the mirror and challenge yourself to say one positive self-statement. Just one. And put a smile on your face. Fake it for me. Fake it until you make it. And that's all I have. So thanks for coming. Well, we were expecting 20 people, and from just talking with the event coordinators, we had over 100 students show up tonight. So yeah, I'm very happy. I'm thrilled. I'm hoping that there are many more discussions that are going to occur tonight and going forward about binge eating and hopefully reducing the stigma. That it's okay to be honest. It's okay to be vulnerable. It's okay to reach out and ask for help, because we're all struggling with our own inner demons.